We can do a lot to lessen her pain, or we can do things that might extend her life but also won't cure her and also won't wake her but might be hurting her. We can't tell. It took 5 seconds to decide. And then I thought of all the people who never had that discussion with their mother or father, who don't know that those are the choices they might face, and how it might help to have a doctor who says blandly, here it all is, and you say, Doc, thanks. I've decided I still want you to keep me alive forever, even if I'm suffering and comatose. And he says, you got it. Only now he could send you a bill, and you could have insurance pay you back for it. So your mother and you will know when the time comes exactly what each choice would bring. And some buffoon decided to call that a death panel. On the list of preventable deaths, diabetes, stroke, ulcers, appendix, pneumonia, we're 19th in the world. Canada is 6th. England's 16th. We're 19th. Portugal is 18th. You're better off in Portugal. Death panels? We have them now. They are called WellPoint and Cigna and United Healthcare and all the rest. Ask not for whom the insurance company's cash register bell tolls. It tolls for thee. What you and I might yet be able to do about all this when my special comment continues. So far, we've covered our collective unwillingness to admit that this isn't a healthcare debate. We are talking ultimately about pain and life and death. And I've recapped the start of my own father's trip through our healthcare system. So what do we do about that system? We'll pick it up there when tonight's special comment on healthcare reform continues here on Countdown. I do not know who the two women were, yet they are indelibly burned into my memory now. They stood outside on a crisp New York morning last week, middle-aged, short, looking more than a little weary. They were wearing lab coats, and they were leaning against what those coats told me was their place of employment, the Mortimer B. Zuckerman Research Center at Memorial Sloan Kettering Cancer Center. The women in the cancer researchers' lab coats were smoking cigarettes. I've seen a lot of startling things in my more than 40 days and 40 nights alongside my ailing father inside this nation's fractured healthcare system, but nothing seemed to me to better symbolize the futility, the ram your head against a wall futility of this gigantic medical entity that we have created that seems to have not only broken free from human control, but which has to some great measure enslaved us. 23 stories tall, built partly with a $100 million gift from the publisher of the New York Daily News and U.S. News magazine, and two of the cancer researchers are standing in front smoking. That isn't the only picture that haunts my dreams. A man walking out of another hospital, casual, purposeful, in control, the red stitches on the left side of his shaved head outlining a space as big as a large potato and at least an inch higher than the rest of his skull. I don't know if he was getting better or he's getting worse. I don't know if he had just gotten good news or bad. I don't know if tonight he's healthy or he's dead. Months ago, I got in line at a drugstore here. A woman ahead of me, obviously a familiar figure to the young pharmacist behind the counter, trying with mixed success to take in the gentle explanation. You've maxed out your prescriptions on that insurance, the professional said slowly. I can't give it to you. Customer shook her head in resignation. It was like the medieval courts of chancery, where if you were poor, you could take your lawsuit against the rich or the government and hope that when they picked the handful of cases to be heard that year, they'd pick somehow yours. If they didn't, you could try again next year, or in some cases every year for 20 next years. The woman who needed the prescription spoke even more slowly than the pharmacist just had. She had almost no hope in her voice. Try the Cigna, please. Another drugstore late at night, and the pharmacist there was a friend of mine. You have to do something about this, he said loudly as he handed me my refill. Then he reached for somebody else's prescription. You see this? Antifungal cream. I just filled this. You know what this costs wholesale? $4. You know what I have to sell it for? $263. I sell it for less and I get fired and maybe we lose our license. And then this. Last Saturday, I leave my father 24 hours after serious surgery that probably saved his life, serious enough that he was still under sedation, and it would be another 24 hours before he knew where he was or who I was. And yet I knew he was okay, because I'd gotten him the best care in the world. Literally, his surgeon is considered one of the top 5 guys in his field alive today. And even I can tell he absolutely nailed the operation. And I know that after my father was to wake up when post-operative fluids would get into his lungs and he had trouble breathing and he had to inhale after every word, they would give him a drug called Lasix that would start to drain the fluids, and within 5 minutes he'd be breathing easier, and within 15 it would be like nothing was ever wrong. And that this was just one of 20 drugs they can use on him, not just to make him better long term, but just as importantly and twice as imperatively to stop his pain short term. And I marvel that we have come so far that you can barely take care of your life, like he will admit he hasn't for 80 years. You can even be as dumb as those two women outside the Cancer Research Center smoking away, and there's still a kaleidoscope of drugs and therapies and nurses and diagnosticians and psychiatrists and x-ray techs and surgeons, and all of them are capable of undoing the pain and curing the sickness and forestalling death. As I walked down the hallway from my dad's room, I allowed myself a brief moment of selfishness. I'm sorry. I'm sorry that I'm happy that I can spend whatever it takes to help my dad get better, to keep him around. But maybe I can atone for that selfishness by making this case tonight to you, to whoever sees this, that we have to make these wonders of life and health and peace of mind and the control of pain available to everybody. And this is boiling in my brain that day, and I take the shortcut out to the street through the emergency room, and that's when I hear my name called. And it's a man roughly my age, and he looks worried to death and really familiar. I haven't seen him in 32 years. He was the nephew of the two brothers from Brooklyn who used to run the baseball card shows when we were both kids. And his uncles were the businessmen, but he, like me, we were the kids collecting mostly for the fun of it. And it's amazing to see him again, joyous almost, just for the sake of the continuity that the accident of us running into each other provides to us both. And he asks what I'm doing there, and I tell him, and he smiles, because my father used to go to those card shows with me. And Mike remembers him. Then I ask Mike why he's there. My daughter's in ICU, he says. 3 weeks now, and the worried look returns to his face. Lyme disease. It's one thing, they knock that down, then it's another. There's a brief pause. Tomorrow I will have to sell my farm. Did you know I had a farm? I don't have to ask him why. He then goes the next step. Hey, you want to buy my card collection? I've got some great stuff. We must reform a system that lets my father get better care than yours does, or better care than Mike's daughter's does, because of the accident of life that I make more money than he does, or my checkbook could hold out longer than his does, or yours does, as the bills come endlessly like some evil version of the enchanted water buckets from Fantasia. The resources exist for your father and mine to get the same treatment, to have the same chance, and to both not have to lie there worried about whether or not they can afford to live. Afford to live! Are we at that point? Are we so heartless that we let the rich live and the poor die and everybody in between become racked with fear? Fear not of disease, but of deductibles? Right now, somebody's father is dying because they don't have that dollar to spend. And the means by which the playing field is leveled and the costs that are just as inflated to me as they are to you are reduced, and the money that I then don't have to spend anymore on saving my father can go instead to saving your father. That's called health care reform. Death is the issue. How can we not be united against death? I want my government helping my father to fight death. I want my government to spend taxpayer money to help my father fight to live. And I want my government to spend taxpayer money to help your father fight to live. I want it to spend my money first on fighting death. Not on war, not on banks, not on high-speed rail. Spend our money, spend my money first on the chance to live. And we must be unanimous in this, not to achieve some political triumph for one side against the other, but to save the man or the woman or the child who will be dead by morning in this country, in this century, on our watch, because we are not spending that money tonight. I will not settle for a compromise bill. And I will extend my hand to those who are scared of the inevitability of death, but who've been told they are scared of reform, those who've been exploited by the others, paid or forced to defend the status quo. We must recognize the enemy here. It's an enemy capable of perverting reform meant for you and me into its own ATM that mandates only that more of us become the slaves to the insurance companies, the moneyed interests that have bled their customers white and used their customers' money to buy the system, to buy the politicians, to buy the press. It cannot now even be checked by the government. Ordinarily, the solution would be obvious. We would have to do it for the government. We would have to bring the insurance companies to their knees, to organize, to pick a date, to say enough, to at a given hour, on a given day, stop paying the premiums. An insurance strike. But the insurance company's stranglehold on us is so complete right now that lives would be risked. Lives would be lost by the very act of protest. What parent could risk the cancellation of their child's insurance? What adult could risk giving his insurer the chance to claim that everything wrong with him on the day of an insurance strike was now